Unfortunately, since the pandemic, we've seen so much more anxiety in children. You can have up to 20% of children present prior to age 18 with anxiety, whether it's just from a situation or it's more chronic. And the way that they can present, they can have some panic attacks where they can really get frightened. They can have school avoidance, or it could be more common things like they don't want to sleep alone. You can start seeing younger children where they're chewing through their clothes. They can be irritable, just so many different scenarios of how anxiety presents. There are a lot of resources online for anxiety. I think it is okay to look on the web a little bit for some easy processes like teaching them how to breathe, or maybe using something called imaging, positive imaging, where they can get some photographs, which is old age, I know, but of like their pet or favorite vacation spot that they could take with them to try to calm them down. And that's fine to do. There's something called grounding if your child's a little bit older, where if a child is starting to get upset or you feel like your child may be starting to have a little panic, they can start to use their senses, and you tell them to look around them and to see things that they can touch, they can see, they can hear, they can feel, and to put themselves back in their moment, in their environment, to see if they can get themselves back down or grounded. So depression definitely has criteria to meet for depression. If you start to see your child is becoming alone, losing interest in activities that they were previously involved with, they're sleeping more or sleeping less, their grades are starting to fall, they're losing interest with their friends or activities that they previously liked to do at all, if they're talking about not wanting to be there, you're seeing crying episodes, changes in weight, appetite, those are all signs of depression. That probably needs to bring, as well as anxiety, being brought to the attention of a provider, physician, or someone who their child sees or adolescent sees. We often get calls where the child has had suicidal thoughts or suicidal ideations, and at that point you have to determine if they should be seen here or go to an emergency room. Unfortunately, we're seeing depression younger and younger. We have many, many resources here. Obviously, we give them resources. We also have resources for referral, for counseling. We work in partnership with our pediatric psychiatrist, and for depression, they need counseling. We can do medications, but depending on their age, counseling is definitely recommended as well. Definitely come and see your pediatrician or your provider, because I feel like if you're just wandering out there as a parent, you don't know what's going on, at least we can begin to sort through what your child is going through. Is there a circumstance that has been causing the behaviors that you see? Is your child having problems in school? Is your child having problems socially? Is someone ill? Has there been a change in family dynamics? Is there something that can maybe be fixed on a different level than what you've been looking at? And then we can maybe make a diagnosis and get you proper resources to begin to help your child. We also use screeners now, that there's many screeners that we can help to accurately diagnose a child, to begin to sort out whether they're looking at anxiety or depression or starting to have problems in school, that can help us to clarify what may be going on. And as with everything else, if we feel like it's something more severe, we definitely will refer and get help.